One of the problems that may occur in IBD, in IBS, in FGDs or functional gastrointestinal disorders, you're eating something. You're not sure quite what it is, but sometimes your bloating is worse, your constipation is worse. This can be due to one or two foods in your diet that don't sit well with you. And by using the elemental diet, you reduce the amount of irritation from these foods. The elemental diet is, if you haven't heard of this, a meal replacement that is unique for a few reasons. One, it is pre-digested. Now that may sound a little bit gross. We're not talking about sort of the mama bird, baby bird sort of pre-digestion, but pre-digested so that it's low fiber, essentially zero fiber, zero residue, and doesn't require your system to have to work to process the food stuff. And for those with IBS, IBD, whether it be UC or Crohn's, this pre-digestion helps to make the nutrition easier to absorb. If you're someone who has digestive symptoms, you may notice that really rough and raw food is harder on your gut. So take that concept a step further or a few steps further, and having a meal replacement that is pre-digested makes it very easy on your gut, almost soothing. So pre-digested, and along with that, or partially because of that, the nutrition, the protein, carbs, and fats are absorbed very quickly in the GI tract. Therefore, you will not require down the line to have to work. So within the first few feet of the small intestine, you'll absorb the elemental diet, and the remainder of the intestinal tract won't have to work to process, which can give those tissues a break. But also, if there is an overgrowth or dysbiosis, you can help starve and, at least theoretically, rebalance that overgrowth. They're hypoallergenic, meaning they are designed to be devoid of anything that may trigger inflammation. So they're low antigen. One of the problems that may occur in IBD, in IBS, in FGDs or functional gastrointestinal disorders, which affect roughly or up to 40% of the population, can be these undetermined food intolerances. And so you're eating something, you're not sure quite what it is, but sometimes your bloating is worse, your constipation is worse, your gas or your GERD is worse. This can be due to one or two foods in your diet that don't sit well with you. And by using the elemental diet, you reduce the amount of irritation from these foods. And at least what I've seen clinically is with a period of this, those foods are better tolerated as your system becomes healthier. And this is a general trend that we see when people improve their gut health. They are more tolerant to food. Sometimes people think that using a meal replacement will lead to weight loss. I think a better way of thinking through this is it should have a corrective effect. Like many therapies in GI, let's say probiotics, they can improve constipation in those who are constipated. They can also reduce diarrhea in those who have diarrhea. So they have more of a corrective effect. And if you're malabsorbing nutrition, then the elemental diet can help you gain weight. And that's been shown in some studies. However, if you're really inflamed, perhaps you're overeating because this chronic GI inflammation is skewing your neurotransmitters and your mood, maybe your sleep, and therefore you're overeating or stress eating, then the elemental diet may have a corrective effect in helping you get back to a more normal weight. As long as you're not under eating when using the elemental diet, meaning let's say you're eating 2,000 calories per day and you start doing this half your calories from elemental and half your calories from food, you want to be careful that you're getting about 1,000 calories from the elemental diet and not inadvertently saying, well, let me make one shake, that's 300 calories, and that will be half of my food for the day. So now you went from 1,000 calories for that half down to 300. So you want to be careful about that. The rules here are not written in stone. If that's working well for you and you go away for a weekend and you don't want to have to worry about it, fine, not a problem. If you haven't used it for 3 weeks and then let's say you go to a wedding and there's a bunch of celebration and food and alcohol and you come back and your gut's feeling a little bit banged up, could you do this for a 2-day reset and then do the hybrid approach for 1 or 2 weeks until you feel like your gut health has gotten back on better footing? Absolutely. There's a lot of freedom with the application. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. What are the tools to remedy SIBO? And the first is a elemental diet. This trial comes from Mark Pimentel's group, published just this year, 30 patients with SIBO and or methane overgrowth. They were given a pre-post SIBO breath test using lactulose. Look at this. The eradication rate ranged anywhere from 60% up through to 100%. What did they do? They gave people an elemental diet as their sole food for 2 weeks. Now, I do feel that this application of the elemental diet is a little bit overkill. If you wanted to do it, if you feel great while doing a prolonged elemental diet, 2 weeks, you can. But there's a lot of research in a different but similar condition, inflammatory bowel disease, so think Crohn's, ulcerative colitis, that uses a different application. And this is what we're doing at the clinic, and at least anecdotally works very well for SIBO, IBS, food reactivity, and the like. This is what's known in the research literature as a hybrid. And how this has been done in some of the research studies is you have a large group of people with inflammatory bowel disease, and half of them get no treatment. The other half, they're told, replace roughly half of your food in a day with these elemental shakes. This is easy to do. A lot of people prefer a shake, let's say in the morning anyway, and maybe another one post-workout. So some people might already essentially be doing a hybrid meal replacement shake. All they'd have to do is swap that in with an elemental diet to do what's been done in a number of trials in inflammatory bowel disease, which have shown very good outcomes. And specifically the way we do this at the clinic, and we do have a trial lined up to study this and hopefully publish on this. We start off with what we call a 2 to 4 day reset, meaning attempt to be only on the elemental diet for 2 to 4 days as the reset. Then from there, replace half your calories roughly per day from the elemental shakes. And then the other half can be whatever diet you're on, low FODMAP, candida diet, whatever it is. This seems to work very well, and it's not as high of a bar as the 2-week exclusive. Nonetheless, whether you do it 2 weeks exclusively, the reset to the hybrid, whether it be anecdotally clinicians reporting results from patients or the small number of trials on SIBO directly, this is a win, the elemental diet for SIBO and for SIBO symptoms. Now, you might also be wondering, is this something suitable for candida? The context here is elemental diets, because they're using a fiber-free formula, knowing that fiber, prebiotics, which feed bacteria, and FODMAPs can flare SIBO and symptoms. These formulas use simple carbohydrates. But while simple carbohydrates will not feed bacteria, they may feed fungus or candida. The elemental diet does use maltodextrin, this easy to absorb carb source. And for those who are wondering if they're a fungal type, and if my claim is that starches and sugars are bad for this type, does that mean if you're a fungal type, you should not use an elemental diet? I don't think that's the case. Now, clinically, I haven't seen that. With any therapy, some people have a negative response. So we always want to factor that in. There have been 2 studies that found either a neutral effect of the elemental diet on intestinal candida or a benefit. The one exception for whom an elemental diet might not be a good fit is people with this sort of oral thrush or upper GI nasopharyngeal candida. And so in these cases, you may notice phlegm, mucus, runny nose, white tongue. And for those individuals, a elemental diet may not be a good fit. Let's discuss a very interesting study, one more data point supporting how effective elemental diets can be, in this case, in reducing gut inflammation and gut autoimmunity, as seen in a model of Crohn's. And let me start with this summary of the findings. And what you're seeing here in this group of Crohn's patients, Crohn's being a inflammatory and autoimmune condition of the small intestine and or large intestine, they were followed for about a year, and half of them were consuming elemental diets. The other half were consuming regular diet. And for the elemental, and I'll come back to defining this in a moment, but they were consuming about half their daily calories from elemental dieting, the other half normal food, compared to the other group that was eating just a kind of control diet, if you will, an ad libitum diet. And what you're seeing here is a halving of the relapse rate over a year period, from 64% chance of relapsing with Crohn's if you were eating a normal diet, as compared to a 34% relapse rate if you're using the elemental diet. A few of the other points I wanted to connect here. No adverse events occurred. Compliance was similar in both groups, and this is reasonable to conclude, or for us to see, in that all you're doing is taking a meal replacement shake. So it's not difficult. Some of the formulas taste better than others, so yeah, that could be a factor with compliance. And the caloric intake and body weight stayed the same amongst both groups. An elemental diet, we refer to this loosely in the clinic as a gut reset, is a simple way to reduce the antigens going through the gut. And as evidence for the power of this intervention, there have been a couple trials that have found for either IBD or for rheumatoid arthritis, IBD being inflammatory bowel disease, autoimmunity in the gut, an elemental diet is as powerful as the steroid anti-inflammatory prednisone. So if you're not sure, what diet do I do? How do I shop accordingly? A simple on-ramp to calm things down can be an elemental diet reset. Certainly not the only tool, but I think a really simple and powerful one. I'm here with Juan, who's had some really good results with Elemental Heal, and he was kind enough to share his story with us. And so we're here today to kind of expand on that. Juan, thank you so much for being here.
Sure. Thank you, Dr. Ruscio. After 6 years of trying to have babies with my wife, I was diagnosed with infertility. And but at the same week, I was also diagnosed with an autoimmune condition, some kind of arthritis that the doctor couldn't really put her thumb on because of some blood work. So I started taking Plaquenil or Plaquenil. I don't know how you call it in English because I'm from Guatemala. And it didn't do much. It just made me feel worse. You know, it made my gut symptoms, because I also had a lot of gut issues, made me feel worse. I tried something similar to the protocol you put on your book, because at that moment I read another bunch of books on natural medicine and natural approaches to these kind of conditions. So I did something similar, and it helped a lot. And 3 months later, my wife got pregnant.
Great.
With those just following protocols, changing to a paleo diet, and doing a bunch of herbs, very similar to what you suggest in your book. But the gut issues and the joint issues were, even though they were better, they kind of were coming on and off. So I finally read your book, and I'm going all the way with my testimony, but if you want to interrupt me at any point.
I mean, this is good, because what you're describing, I think, is a really important concept for people to understand, which is you can go through some of the book protocol, which is starting with dietary and lifestyle interventions, and then things like probiotics and antimicrobials. And for some people, that will get them close to full remission, but not all the way there, like you're describing. They'll still have some of these gut symptoms or joint symptoms or whatever symptoms kind of coming and going. And that's exactly why one of the things you can next escalate to in the Healthy Gut, Healthy You protocol is the elemental diet. So, and I guess that's what you're kind of coming to next.
Exactly, yeah. I also read a bunch of theories about how fasting helps your body in general. You know, fasting is an amazing ancestral way of healing. And so I did a couple of 3-day fasts, and they kind of got me there, but they didn't really got me there. And at the third day, I was always fishing for food. It was really hard.
Yeah.
Then I bought the elemental heal, and I was like, all right, I'll try this, but I'll try the fast first, and later I'll do the elemental heal. I'll try to do like Rambo, just go all the way, dive in, and then so I did the fast, and on the third day, I thought to myself, I'll keep on going. I'll just use the elemental heal to keep me going, on the really hard, because the third and the fourth day are the hardest days. So I used
from going from a strict water fast, and then you started getting hungry, and you put in place of the water the elemental heal, essentially.
Exactly.
Yeah,
that's what
also a great point. And one of the concepts I discuss in the book, which is theoretically, if we could have you water fast for 2 weeks, that would probably be great for your gut. That's going to be hard to do from a compliance perspective. And most people, I just don't think are robust enough to be able to handle a 1 or a 2 week fast, which is what's so nice about having the nutrients available in the elemental heal. It's about as close as you can get to a fast, because the ingredients absorb so quickly in the intestinal tract, but you don't have to go hypocaloric and labor under that, feeling tired and hungry and irritable and not sleeping well if you're trying to do a prolonged water fast.
Exactly. And that's exactly what I did. I used the elemental heal to keep me going. And then the hardest days were the third and the fourth, as I was saying. And so I kind of cheated, if you might call it that. But I used a little bit. Only at night, I did 2 scoops of elemental heal and just drank it. It was delicious, especially when you're fasting. It's like heaven on earth. Yeah. And so also I used it, and I did the 7-day water fast. I kept on going just with water after that. And all the issues went away. Of course, I didn't have any gut issues because I didn't go to the bathroom after a couple of days.
Sure.
And on the 7th day, I started with the heal again. So I prolonged it a little bit. And started with the healing protocol to start, bringing food into my system again. I started with the elemental heal, and it worked perfectly. All the symptoms stayed away. The gut issues, that was the only thing that I had a little bit of a hard time getting back to with the elemental heal, because it's liquid. So I didn't go to the bathroom every day, and I wasn't sure. But I just let it be whatever it was. But I felt wonderful. And then I kept, after the 3 days of elemental heal, of the protocol you suggest in the bottles, I started incorporating some easy to digest, like organic chicken broth and easy to digest veggies and stuff. And man, I can tell you my life before that and after that. It was a huge change. After that, I used because I bought 3 elemental heal bottles, and so I still had a lot of it. So I used it for intermittent fasting.
Sure. And
so
how were you using that? Were you sipping on an elemental heal shake throughout the morning and then having lunch and dinner, or?
No, I just skipped dinner.
Gotcha, skip dinner. Okay.
Mm-hmm. Yeah, I prefer to eat in the morning.
Okay. Yeah, everyone has a different application, and I mean,
right.
There's so many great things here. One, I just want to kind of bookmark is the fact that you don't have to use the elemental heal according to a really rigid guideline. Sometimes people have a hard time with, well, I'm either going to use it for 2 full weeks to treat SIBO, or if I'm not doing that, then how am I supposed to use it? And there's not necessarily a right way or a wrong way or a black and white box that you have to use it in. And so in your case, the water fasting was something that intuitively felt like it was going to be a good therapy for you. You weren't able to fully do that on its own, so you added in the elemental heal as a way to help get you there, which is perfect. It's really listening to your body. It's personalizing the use to what seems to work for the individual. And then from there, you went into what I would call kind of the hybrid approach, where you have some food and some elemental diet, or
right.
AKA using it in an intermittent fasting approach. And you use it at dinner. Some people use it in the morning, but just a great reminder that you can listen to your own body and let your intuition guide you a little bit. And as you're a perfect testimony to, on the other side of that, you can experience significant healing, even if you didn't do it quite exactly as it's typically recommended to do.
Right. And one thing I want to add about it is that it gives you the opportunity, because I think fasting or using heal in a prolonged way it's a great opportunity to also go inside of yourself and deal with the cravings and deal with your emotional issues. And I think that's something, I don't remember if you put it on your book or if I've seen it, because I'm a big fan of your website and the interviews you give. But I think it's something that it might help people out to put their minds on the fact that the emotional issues are also treated when you do that. All the connections you have with your gut and your emotion and with your life and your health in general, you deal with that when you do these kind of protocols. And it's for me, that was very intense and very powerful tool as well. So it was great.
Great. Well, awesome. So very, very happy to hear that, and glad that you found the book, found Elemental Heal. You've used it successfully. And so is it fair to say that your symptoms are pretty much all gone now? I mean, I don't expect you to feel perfect, because I think perfect is sometimes this ideal that, we strive for, but it can never fully reach. No one feels perfect. We're not machines. We're humans. We have ups and downs. But I'm assuming, like you said, you alluded to, there's kind of this night and day difference between then and now. So now joints are good. Gut is good. It sounds like emotionally you're feeling well.
Right. My joints are good. The only thing that I still have an issue with is my knee, my right knee, but I had surgery because I had a trauma there. So that has nothing to do with what we were talking about. And, but then the rest, I'm feeling awesome. I'm feeling really, really good.
Thank you so much for the willingness to be open and use your story to help give other people hope and hopefully some instruction for how they can navigate through not feeling well.
Of course. Yeah. I'm glad to be here because it's been a long road, honestly.
Yeah, the road often is. Tell us a little bit about the road. What were your symptoms? What were maybe some of the things you had tried prior or doctors you had seen?
When I would start my menstrual cycle, my cramping would actually flare up my IBS so bad that I looked like I was about 5 months pregnant and just having terrible pains and all these things. And I would actually have to miss at least one day of work because it was just so terrible. And I just thought, you know what? I'm going to give your stuff a try. So I did, and I used it for, I think the first 14 days. I was supplementing the chocolate one for just a meal.
Did you do 14 days exclusive, or were you kind of doing some whole foods in there also?
I was still eating. I was just supplementing the Elemental Heal for my breakfast.
Gotcha.
So I did it 14 days in a row, and I started feeling a little bit better, and I just thought, okay, well, we'll see how this goes. The next month, I started the Elemental Heal before I started my menstrual cycle, and I was like, oh my gosh, I'm having my own cramping, but it wasn't flaring up my IBS at all. And so I had done that for the next couple of months, and it stopped. And I was to the point, honestly, that I went to my gynecologist and said, you need to give me a hysterectomy because I cannot take this anymore. And then I started doing your Elemental Heal, and he had ran into me into the hospital probably like a month or two later, and he says, hey, I haven't seen you. Are we still on for that, or what do you want to do? And I said, you know what? I have to tell you, I got my gut back on track, and I haven't had those terrible pains. I said, no, I'm not taking that out. I am not having hysterectomy.
Great.
So it's been a life changer, honestly.
Awesome. Well, anytime we can save someone from a surgery, that's of course a huge win. And then also the day-to-day quality of life improvement that you'll see by not having these symptoms interfering with things, obviously another huge win. George has had some help with reading Healthy Gut, Healthy You, and also using our elemental diet, amongst other things. Not fully to where he'd like to be, but definitely making some steps on the road to recovery, and he was kind enough to share his experience with us today. George, hi. Thanks for sharing your story.
Hi, doctor. Thank you.
So tell us a little bit about the road, up to now.
Well, I've kind of had a lot of troubles with my stomach. It seems I've struggled with it. It seems like my whole life. I've had heartburn problems, and I've been on all sorts of medications for that. I've been taken off all of that. It was maybe 6 years ago where it was discovered that I had Lyme disease, and through that I figured out how to eat properly and change my diet, and knew how important that the gut was to your health. Since that, though, I haven't been able to get better, and recently I found out that I've got C.diff. So now I'm struggling with C.diff and clearing that out. And that's where my wife found your book, and we've read through your book, and I've been using your elemental diet and it has been a lifesaver for me. I mean, it truly feels so good in my gut when I get it in there. It's amazing. I've actually been on it now for probably over 3 months.
Now, I'm assuming you're kind of doing a mix and match where you're having some food and some elemental.
I've been trying to mix in food, but with the C.diff, it kind of hasn't been allowing me. So I mean, even I've been on pretty much the elemental diet for that amount of time. I've been trying to throw in baby food as much as I can, but not having much success. So right now I'm on my 3rd round of antibiotic treatments and starting to kind of have some success where I've started to eat some food, but I still have to have those liquid diets to get me through and to get calories in me.
Gotcha. So if not for the elemental, really nothing
I can't get it.
does not go right through you.
Yeah.
Yeah.
With severe like stomach cramps and stomach pain, and then I mean everything that comes with it.
So elemental heal has been helpful, but clearly here we see elemental dieting almost as a rescue therapy, which certainly sometimes we need a rescue therapy. So totally fine. All right. This is Dr. Ruscio. Hope this helps. Talk to you next time.